welcome back. It's still Quest today, and of course, you know that every last segment of it is about business. And this morning, without wasting so much time, Nigeria's healthcare sector may be on the brink of a significant transformation. A 50 million euro financing agreement has been secured to strengthen the country's pharmaceutical and healthcare manufacturing industry. The funding partnership between the Bank of Industry and the European Investment Bank is designed to support Nigerian companies producing medicines, vaccines, and diagnostic equipment locally. But what does this actually mean for everyday Nigerian? One may ask, especially in a country where many people struggle to afford basic medication. Today on Quest, today's business segment, we examine the impact of this development on healthcare. Is it going to give jobs? Is it going to reduce the drug prices and Nigeria's economic future based on that? Nigeria imports a large, very large percentage of its medicines and medical supplies that we know, right? And to be very, very honest, this heavy dependence on foreign drugs exposes the country to global supply disruptions, high importation costs, and foreign exchange pressures. To address this challenge, the Bank of Industry has secured a 50 million euro fund from the European Investment Bank, a major international development finance institution. The funding will provide a long-term financing to Nigerian healthcare manufacturers, particularly small and medium enterprises involved in producing medicines, vaccines, and diagnostic equipment. The financing facility is expected to support pharmaceutical manufacturing, vaccine production, diagnostic equipment manufacturing, research and development in healthcare, expansion of local medical supply chains. If you look at all these that we just stated, you find out that most of them are manufacturers. Experts now say the initiative is designed to reduce Nigeria's dependence on imported drugs, first off, and to strengthen the country's healthcare system. And as a Nigerian, you are supposed to be on the know because healthcare spending is one of the biggest financial burdens most Nigerians and their household pass through. When medicines are imported, prices often rise due to exchange rate fluctuations, shipping costs, import duties, because it wasn't produced here. Local manufacturing could significantly reduce these problems if this fund is being implemented rightly. Now, local manufacturers, in addition, are looking forward to stronger pharmaceutical production, availability of essential drugs, particularly in rural and underserved areas. And I want to have this conversation with you, Samson, because we can go on and on and on about the benefits and what we're looking towards concerning the pharmaceutical area. At this point in time, what difference do you think this fund, 50 million euros in their balance fund, what difference are you looking towards that it to bring forth to us? Do you think it will actually reduce the cost of medicines in Nigeria?
Yeah, like many times we've been recommending that a whole lot needs to be done in terms of local production of
Yes,
goods
yes.
within Nigeria's borders. Okay, this is also another aspect to look at it because I think it was in 2023 2023 in August when GlaxoSmithKline pulled out of Nigeria.
Yes,
Yeah, they
yes.
said they were not going to be manufacturing their drugs within
Yeah,
Nigeria
yeah.
again. They would rather depend on third-party distribution systems. Then they left. Now, 2 months down the line, or rather 3 months down the line, that's in November, another French pharmaceutical company,
Pulled out.
Sanofi left as well too.
Yeah.
Now they cited the well harsh economic um, climate, harsh business climate, okay, in Nigeria. Inflation went up that period because it was shortly after fuel subsidy removal. Inflation went up. There was this forex crisis as well, so it was hard for them to access dollars, for them to
Very
import
true.
raw materials, for them to use in making these drugs within Nigeria. That and many other things that made them to leave, right? So that in itself, their departure made the cost of some drugs to go up exponentially.
Yeah.
Now, that is history presently. But what is happening now is a situation where there is high cost in logistics, importing these um, already produced drugs from offshore into Nigeria, or the APIs, that's the active pharmaceutical ingredients, that's the chemicals that are there to make these drugs work,
Yeah.
right? So we do have local pharmaceutical companies in Nigeria.
Yes, we
But
do.
the thing is, they still import, let me say,
Material.
pharmaceutical raw materials.
Mm.
Now, where they encounter issues is the fact that there is high cost in shipping transportation right now. These days now you pay more. Okay, it's because of what is happening between US, Iran, and Israel.
Yeah.
Yes, so you have to pay more. And it is so because a lot of the key ingredients we use for our local manufacturing of drugs, they come from basically China and India. So certainly you must import them, and the routes they use is affected by, you understand. So with all of this being said, by the time these 50 million euros, which translates to about 85 to 90 billion naira, gets given to these local pharmaceutical companies, it will help them to offset a whole lot of this cost. And of course, we will then see investments in local production of these APIs, key ingredients for making these drugs, right, to work. We will then see investments in this thing. So when there is local production of pharmaceutical pharmaceutical drugs in Nigeria, we expect to then see a cheaper rate.
Because it's now being produced here.
So you're
And
taking out
yeah.
logistic costs, international logistics, you're taking it out of it.
Exactly.
And you at that point you're not really affected by international forces that are played out there. Do you understand? Such as conflict, such as high forex, all of these things you sort of limit their effect on you.
Yeah.
Okay, so by extension, by the time we develop our own pharmaceutical industry here, aside from low cost in drugs, cheaper drugs, we should also see an increment in the employment of skilled labor, and to an extent semi-skilled labor in the pharmaceutical industry as well too. So this in itself is a plus for Nigeria's pharmaceutical industry.
Yes. One may also be wondering, yes, we have secured that fund, but outside Nigeria, if this implementation is successful,
Yeah.
where will this place Nigeria in the map, and why? Because a lot of other countries are looking up to Nigeria, especially in Africa, and we have this vast, a lot of vast population, for example. So where is it going to place Nigeria if successfully we're able to resuscitate our local manufacturers?
I like the fact that you said if we successfully.
Yeah.
Yes, of course, because that a lot of things are dependent on the commitment, the will to make it work.
Exactly.
If not, it's not going to work. Okay, so we need to properly utilize these funds. We're talking about where it would place Nigeria.
Mm-hmm.
Certainly, Nigeria would then become a strong pharmaceutical powerhouse, supplying, at least in the meantime, the continent of Africa. Now,
Mm.
during the COVID-19 era, um, African nations were begging for vaccines. In fact, the vaccines that AstraZeneca and the rest, Pfizer, they developed, and Chinese vaccines as well too. The vaccines they developed, they first of all had to look to take care of themselves first
Mm-hmm.
before
The remnants were
sent
shifted
out.
to us.
Exactly.
Yeah.
So you see, um, if Nigeria can successfully do this, it would help us to become independent of instances where, for example, of which we're not praying for any such pandemic as the COVID-19 to come
Mm.
again,
Mm.
but instances like that, it makes us a bit more sufficient. Okay, that's why I'm saying we should look into investing properly
Mm.
in our local drug production. Okay, investing in getting the APIs for our drugs down here in Nigeria. Okay, so it will certainly place Nigeria as a at least African pharmaceutical
Hub.
powerhouse. Yes,
Hub.
that we
Yeah.
will be distributing to African nations at least.
Mm.
But then, if we
Wow.
have foresight, we should be looking at other continents, not just
Yes.
Africa.
Globally.
Yeah, globally.
That's fantastic because the truth is you will agree with me, my viewer, that it is no longer what it used to be when you go
Mm.
over the counter to purchase even over the counter medications. It's no longer what it used to be. Surprisingly, the prices will first of all put you in shock before you know, but you must have to, because the truth is, as human beings,
Mm.
we need medication for one thing or another. But considering it from the economics perspective, healthcare manufacturing is not just a social sector. Like it's very important. It's very crucial, and it is a very strategic industry capable of driving innovation. Because, like Samson said, when we have these materials here, it will give our manufacturers ample time and space to explore, right? You carry out things
Mm.
and see
Yeah, right.
what becomes what, because other countries, they do these experiments, and when it works they now tell you the real price, the original price, the original cost of what
Yeah.
it will take you to have it in
Mm.
your own country.
Mm.
Then it also drive industrial development. I think this time people are no longer talking about employment like we used to wail it. People are tired, but that doesn't mean it's not in existence. When you are saying something over time, no
Yeah.
employment, no, at some point you get tired.
Mm.
I mean, your tongue gets dry. You now say, you know what? Let me look for an alternative.
Exactly.
But when it boosts this industry, I mean, talents that we have will start coming out, start utilizing their skills, their talents, and of course, export growth. We'll add it to things that we actually ship to other places that will fetch us money.
Mm.
And believe me, if properly managed, we always say, please, when funds are being secured, may it not be channeled into selfish and other things that were not part of it.
Mm.
Let it be used for, just like we're talking about the loan now, that Mr. President got the approval from the Senate.
Yeah.
Please, if we say we're using this for the ports, let it be for the ports. So that when next we have another fund, we know that it's on to the next thing,
Exactly.
right?
Mm.
So if properly managed, Nigeria could become a regional pharmaceutical hub for West Africa. And it's not bad, if you ask me, it's not going to be bad. At this point, Samson, I
Yeah.
don't know if you have your in this particular program your last suggestion or maybe submission when it comes to this area
Mhm.
of development.
Yeah,
Yes.
right. So, um, the thing is, Nigeria, like we said, we
Yeah.
have a local capacity to produce pharmaceutical products. But then we need to consider the fact that there is a lot of fake drugs in the system as well. So, I mean, come on, NAFTA keeps dealing with fake drugs up and down. I think just last month alone, NAFTA burned, destroyed, fake drugs amounting to billions of naira, right?
Mm-hmm.
So then, all I'm saying is, as much as we want to develop our local pharmaceutical companies,
Yes.
we should make sure we do that with tight regulation,
Mm-hmm.
so that the system doesn't get adulterated, becomes watered, okay, by companies that are not really, um, that are not real, okay, that are out there to just produce dangerous drugs, because it would alter our reputation. It would really destroy our reputation to international
Yeah, it's
partners,
real.
right?
Mm-hmm.
Who even assist us with these funds, and then even the ones we potentially would want to sell some of our drugs to, it would be
Yes.
quite a disgrace when our drugs arrive at certain countries and they find out that these drugs are fake.
Mm.
Exactly. So I'm actually calling for tighter regulation, tighter control
Tighter.
of these local pharmaceuticals.
That's fantastic and brilliant. Thank you very much, Samson. The 5 million euros partnership between the Bank of Industry and the European Investment Bank may look like just another financial agreement, but in reality, it touches some of the most critical issues facing Nigeria today: healthcare, affordability, industrial development, and economic reliance. And I want to use this opportunity to also recall that the recent 135 million euro
Yeah.
financing agreement between the same Bank of Industry and the European Investment Bank signal, a strategic attempt to strengthen Nigeria's healthcare, manufacturing, and also agricultural value chain.
Mm.
All these things are available, but then what we are saying is implementation and accountability.
Exactly. Yeah.
So, like Samson said, if they give you this support, they will also be looking out to see the positive effects.